Okay. All right. Well, it's recording, so I think we could just go ahead. Um, and if it's not live, then I'll just share it.
Okay,
Um, but
sure.
anyway, so I just want to reintroduce myself to everyone that's maybe new to the group or possibly doesn't know me. I'm Carissa Kiefner, doctor of physical therapy and a registered dietitian. And my focus is on helping people through the aging process, staying active, aging well, which includes, looking at our brain health, our physical function as we age, and in kind of focusing on those areas, so that we, as we get older, we can, continue to thrive and live in the happy life that we want to live. And today, I'm really happy to bring on Ryan Glatt. I met Ryan Glatt through the brain health training certification program, and he's just a wealth of knowledge. And I just wanted to bring him on so that we can talk about the brain health training and how it can benefit our lives as we get older and actually throughout our lives. So I'll throw it over to Ryan and just tell us a little bit about yourself.
Yeah, thanks, Carissa. Excited to be here speaking with you. And I always love to see people such as yourself going through the course and doing amazing things with it. And really, the purpose of this is to make a deeper impact on people's lives, right?
Right.
Um, we're so used to helping with physical outcomes, such as aesthetics or balance, or things of that regard, which are all extremely important and even impact brain health, both directly and indirectly. But I think one of the biggest concerns that people have that's sort of either stated or not stated, or at least it's not stated enough in the health and fitness industry or professions, is the concerns and the goals surrounding brain health, whether that be around something like cognition and memory, or whether that be something around mood or both, because we all are human and in the human condition, we all struggle and we are all susceptible to modifications in lifestyle, sometimes aberrant, sometimes ones that aren't as good for us, and that affects our brain because it's a very sensitive organ, right?
Right.
And people at any age, it's not just about older adults. It's about people who want to improve their brain function or prevent later decline or a steeper decline later in life. And so it's really important to address this. And um, it's not just about saying, oh, well, this, we think this is good for your brain, or I heard this is good for your brain. That is non-specific. That's very general. But if someone wanted a weight loss program, they're going to expect specifics. So I feel that we need to give the same for brain health, both from a exercise perspective and even a nutrition perspective.
Mhm.
Some challenges, we're still learning a lot about the brain, right? But we know enough to do better than just say something's good for you and not go any deeper than that. And
Right.
so that's where this is coming from. I think that's rather universal, whether you're professional or not, that there is this concern,
Mhm.
not immediately for yourself, or it's not a priority for someone else around you in your circle, whether it's friends or family or loved ones. It probably is, whether they admit it or not.
Right.
Uh, and so it's really important to address it. And so it's kind of like getting more education on stigma and mental health and how to address it or not address it in our profession. As such, with brain health, it's something that is often brought up in a way that isn't too elegant, it isn't very sophisticated, and is sort of subject to a lot of jests, jokes, or assumptions about aging, like it's normal to get dementia with age, for instance, or that's just, oh, okay, boomer, like that whole phrase. And there's a lot of kind of gross, like, perspectives on that and negative age beliefs. And there's a lot going on there. But I think we can do our job, whether we're a professional or just someone trying to live a healthy life. Our job is to understand it better so that we can do something about it for ourselves and others. With that said, I've been in the health and fitness industry for 11 years now, and I've done personal training, manual therapy, health coaching. I'm still all those things, but I just completed a master's in applied neuroscience. Um, I've completed the second version of my course, the Brain Health Trainer course, which is the first ever course to comprehensively address the basics of exercise for health and exercise professionals, and then talk about the role of exercise in the brain. Of course, what do you do about it? It's not a, I think TED Talks are interesting. I think books are interesting. I think, New York Times articles are interesting. That's how we casually consume information. And that's how the word gets out about stuff like this. But we need to do something about it, right? It's not enough to say that more blood flow goes to the brain, or we release trophic factors like brain-derived neurotrophic factor with exercise. We got to do something with that information. And so I've dedicated my career to that. I grew up overweight as a kid. I used active video games like Dance Dance Revolution to lose weight. Little did I know, many, many years later in my career, in my life, that I would be looking at gaming and aspects of gaming that don't have to be within games themselves, but cognitive demand during exercise to see if there's some sort of unique benefit to doing that, whether it's psychological, whether it's cognitive or behavioral or all of the above, or a combination thereof. And so when I talk about this concept, people say, well, that's really interesting, combining brain and body training. Why would we do that? Well, I can get to that, but my hesitation, even though I'm a self-claimed expert in that realm, which I still feel I'm not, I would say that most people hear about the unique benefits of this approach of combining brain and body, and it makes natural sense to people. Why would you combine cognitive demands with your movements? It makes sense. And the synergistic benefits are encouraging in research, both in animal studies and some human studies, and some systematic reviews on exergaming, for instance, or dual tasking. We'll define all that. Mm-hmm. But it's important not to get shiny object syndrome when it comes to optimizing health in general, but specifically in this domain. And unfortunately, I feel like my expertise is a shiny object. With that said, I often find myself redirecting people away from me towards something that I believe is a little bit more beneficial. And if we give the perspective of diet, which I think you would appreciate, there's plenty of coverage and articles on antioxidants from blueberries or coffee and that being good for the brain. But I don't think anyone within good reason is saying that I should only eat that, but I should neglect other foods that I've heard are good for me, right? That's nonsensical. However, we do that with exercise, perhaps because exercise takes more time, or it's voluntary, or we have this silver bullet thinking. And so what I like to do is look at like carbs, fats, and proteins. And regardless of your philosophy around nutrition, the metaphor is debatable. But I would say that individuals who understand carbs, fats, and proteins know there should be a ratio. Whatever that ratio is dependent on your biology, your goals, the expert that's working with you, and what their biases are and how much they know about it, and all sorts of other factors like access to food and preferences and all this stuff that comes with just eating, which seems so basic on the surface, but we had to mess it up and be human. So when it comes to carbs, fats, and proteins, the equivalent of that for exercise is aerobic exercise, resistance training, and neuromotor training, which we can also call motor or coordinative fitness. So those three categories are really important, and we can get into why. But there's various things that happen with exercise at different levels. There's the micro level, the macro level, and the behavioral level. The behavioral level is stuff we feel that we're familiar with, changes in cognition and mood. So when we exercise, we improve our mood. And in the short term, we improve our cognitive abilities, things like attention, memory, processing speed, what's called executive functions, which is like the CEO of your brain. And it improves those in the short term, depending on exactly what type and how long and how intense and all these different ingredients or variables of exercise. But in the long term, in the medium and long term, they can improve more significantly depending on your age, your biology, your cognitive health at the time, exactly what you're doing. So that's at the behavioral level. I think that makes sense to us. Who doesn't feel better or sharper after exercise, regardless of the type, right? Mm-hmm. And it makes sense that over time, that those benefits would either compound, maintain, stick around longer, or get better, right? Or you get to a peak and then you can maintain that peak or at least slow the curve. I think that makes sense to people, but we don't really recognize it that way because the main motivators of exercise typically are not that. And so if we're not looking into the future for that goal, then we're probably not going to be thinking regularly about that goal. However, on a day-to-day basis, multiple times per day, especially when we wake up or when we've had a long day, we're keenly aware of how we feel. Mm-hmm. Feel. It's emotion, mood, right? And cognition. Do I feel sharp? What's my attention? All these different things that allow us to interact with the external world. So we're getting this feedback every single day and every single moment of the day, whether you paid attention to it or not, depends on if you're busy, if you don't want to pay attention to it, if you're distracted, whatever it is. And it's really interesting to think that we don't look in the mirror all day, every day, right? We might look at it a few times a day, but we have this sense of who we are and what we are and how we're doing all the time, or at least it's available to us. Well, at least now with selfie cams, you can look at yourself all the time. That's theoretically helpful or detrimental. If you have something in your teeth, very helpful.
Right.
If you're criticizing all day, every day, not helpful. But you see what I mean. And so that's the behavioral level, and exercise can affect us there. But why? Why does it affect us there? Well, it affects us there for various neurophysiological reasons. There's the micro level and the macro level. The macro level is if we held our brain in our hands. It can grow in size, or it can change in electricity or function. And it can do that in very specific lobes or regions of the brain, or it can do it in networks. So networks are things that may not necessarily be connected, but when this one lights up, this one lights up. Mm-hmm. Nodes, if you will. So the macro level includes functional and structural changes to the brain. So your brain has this inherent neuroplasticity, the ability to change in response to experiences, and exercise is a set of intensive, directed, purposeful experiences, right? And I say intensive in the sense that you set aside 1 hour, 20 minutes, or 30 minutes to do that thing, right? Same thing with practice with an instrument, or with work, or with a sport, right? So we do, or mindfulness, we're intentionally setting aside this intensive effort to do something. So the reason those things can affect our brain is because neuroplasticity responds to that effort, okay? I can either change in functional neuroplasticity or structural neuroplasticity. Functional would be the electricity changes, either at the very small micro level between the neurons themselves and the synapses, to the larger level when it comes to things like networks of the brain, right? At a structural level, we can increase, we think, neurons in the brain, a process called neurogenesis from exercise, and that could facilitate, one of the things that could play a role in volumetric changes in the brain. So for example, one area called the hippocampus, an area of the brain responsible for learning and memory and emotion, seems to be very sensitive to lifestyle, including exercise, but also stress and sleep and things like that. So it behooves us to have good things in those domains. And so when we exercise, we see an increase in the hippocampal volume for most of the population, especially those that were sedentary prior, because there's a ceiling for cognition and brain health. And the further away you are for that ceiling, except at there's some exceptions for that. But typically, if you're further away, there's further to go. So 20, 30-year-olds are usually closer to their peak because of development. You can still improve cognition, but maybe you need more effort cognitively and physically to get there. And actually, that's what some systematic reviews are showing, that coordinative demands with cognitive demands for younger adults seems to be more effective for improving cognition than other types, but it doesn't dismiss the value of the other types, right? And so going back to the micro level, there's blood flow and neurotransmitters and growth factors like brain-derived neurotrophic factor, or BDNF, which has been called miracle growth for the brain, nerve growth factor, vascular endothelial growth factor. Insert cool Greek word and growth factor at the end, and you'll have a ton of them, right? But the idea is that we can elicit this neurobiological smoothie that comes from exercise that's really good for our brain at the smaller micro, macro, and behavioral levels, especially over time. Mm-hmm. We can appreciate that, right? And I think it's important not to get too mechanistically obsessed. If we just focused on BDNF and said, goodbye, I'm an expert, you heard about BDNF, I have blessed you with this knowledge, goodbye. Right. That's changing anything I do differently. It might improve the frequency or the act of doing more exercise because I know it's beneficial because it releases this protein. That is fantastic. Or I might be in a cognitive or mental funk and I'm going to do exercise because I heard that's good for me. That is fantastic. But we can go a bit higher here. We can go a bit actually deeper and higher. We can expand that. And so that's why exercise is important for you. But the reason we might want to consider some elements of variability perhaps is because when I talk about this neurobiological smoothie, well, the ingredients in that smoothie probably change. There's things in common that all smoothies have, right?
Right.
There's some sort of liquid, there's some sort of solid, there's some sort of nutrients, right? So there's some things that are similar in all forms of exercise that happen, such as brain blood flow, the degree of which is dependent, functional changes in brain activity. But the way it changes might be different depending on the activity and the duration, the intensity. And so if we were to have different smoothies, right? And each smoothie and its contents would perhaps be dictated by your goals and your biology, then we might change the emphasis or the recommendation of these different smoothie types, which once again would be aerobic, resistance, and neuromotor or motor and coordinative. And so there's also subdomains. So, exercise professionals such as ourselves know that there's different types of aerobic training. Actually, everybody knows this. There's steady state training, there's interval training. There's linear weightlifting on a machine, and there's functional training with weights. There's dance, sports, and martial arts, and there's mind-body exercises like yoga, tai chi, and qigong.
Right.
Which one's the best for your brain? Once again, which fruit is best for your brain? Which vegetable is best for your brain? That conversation takes us down a dark path, but if we recognize each of them has unique value, and especially in combination, then we should probably go down that flow. Now, more research is needed, but there's actually a lot of research pointing towards the benefits of what's called a multi-domain exercise program for brain health. And a multi-domain exercise program means you do aerobic and resistance, not just aerobic. Mm-hmm. So longer term. It also shows that the research shows that 150 minutes of moderate to vigorous activity at the minimum will elicit positive brain benefits for you. Mm-hmm. There's additional benefits for more minutes. There's additional benefits for high intensities. There's additional benefits for strength training. There's additional benefits for neuromotor training. And we have all these individual studies and systematic reviews popping up saying, well, this exercise did this and this exercise did that. And it was in this population and it works in this population, but not that population. So it's almost as if exercise truly is medicine. Right. And just like people respond differently to medications, and it depends, so as it is with exercise, which is really cool because we want to get respect for being like part of the medical profession or part of an allied healthcare team. And exercise truly is not just medicine, but like one of the most powerful medicines. And I'm not just saying that as my bias. The World Health Organization states it, especially in relevance to preventing cognitive decline. So if it's one of the most powerful things that has one of the most confident recommendations based on research, then why aren't we doing it more? Well, I do blame a little bit of shiny object syndrome. We hear more about, like, when we talk about brain health, what sort of products or interventions have you heard of? You've heard of brain training, you've heard of supplements, you've heard of hyperbaric oxygen chambers, you've heard of neurofeedback, you've heard of functional neurology, and it goes down, and it doesn't mean those things are bad or not helpful or they don't have value. They probably do, and research is coming out to show in varying degrees that they may. Right. I can't summarize all of those in one or two statements. I'm sure some people want to come after me and kill me because that's their business. But what I'm saying is, when we have something that has so much evidence base and has so much power, and we don't utilize it well or recognize it or we're aware of it, we are literally wasting years, and we're contributing to the problem of this cognitive decline epidemic where 5.8 million people are being diagnosed with dementia. It's the number one cause of disability and poor health. 2/3 of our women, I think 65 or 75% are over age 80. I mean, early Alzheimer's disease continued to be a huge problem, but it's not just dementia. Because a lot of people say, well, if I don't have the problem, I don't have to worry about it. Well, you do, because it's about prevention. And some of the signs of dementia, asymptomatic signs in the brain, will show up 20, 30, 40 years perhaps before it happens. Right. So health is a goal for everybody. And I believe one of the most important goals, because I can hurt my elbow or I can hurt my brain. Which one's going to affect my quality of life more, right?
Right.
Doesn't mean, getting out of pain isn't important. It is, but and it affects brain health very, very, very significantly, actually. So I say all this to say that we want a combination of those three categories: aerobic, resistance, and neuromotor, more than just one type. And that's true for anything. And so we also want to hit that 150 minutes of moderate to vigorous at the very least. We also want to do it in a multi-domain fashion, so at least 2 modalities. And then we also want to be able to do this for at least 52 hours of exercise. As a systematic review recently showed that that's what it took for older adults with and without cognitive impairments to get significant cognitive benefits, like processing speed and executive functioning. Now, that it actually didn't matter what type, which is really cool. Because on the other hand, I'm like, saying it has to be specific and it has to be these types and variability. But this says like, oh, it might not matter. But
Right.
that's I would say it would matter if you're willing to go there. But for those that are low motivation, low experience, looking for the minimum, that's good news, right? So
Right. Yes, it has to be
over what?
sustainable, right? I mean, that's a big piece of it too, is being sustainable. You gotta
Absolutely.
wanna do it, so.
Absolutely. And that's a big piece of enjoyment as well.
Mhm.
And so there's psychological benefits to that. There's social benefits. There's neurophysiological benefits to that. But when it comes to like over what period of time, it could be 3, 6, 12 months. Everyone's different and human behavior is really complex. And so we got to figure that out. So that brings me to dual tasking, right?
Okay.
Based on this breakdown, what category do you think dual tasking belongs in?
So dual tasking would be more attention.
Or not cognitive domain, my apologies, but aerobic resistance or neuromotor.
Oh, dual tasking, aerobic,
It could be neuromotor as well. So
neuromotor. Yeah.
many of dual tasking exercises that are not aerobic, like Tai Chi,
Right.
right? So let's break down neuromotor. And don't worry, I'm just going to make you take the test again. So let's break down neuromotor. What does it mean? Okay, neuro, brain, motor, body, done, right? Dual tasking can mean a lot of different things, but it typically refers to one cognitive task and one motor task that are performed simultaneously. And there's different ways to experience dual tasking. There's the idea of a distractor task. So you're walking while talking, right? Or there's an example of an integrated task, like in dance or Tai Chi or a sport. The cognitive task and the motor task are integrated. And both can be valuable, but it depends on our population. It depends on why we're doing it, and it depends on how we're doing it.
Right.
Dual tasking has been found. It's also called a lot of different things: cognitive motor dual tasking, neuromotor training, brain and body training, combined cognitive physical training, dual tasking. It's got all these names.
Mhm.
And there's other things that it's present in, like extra gaming or active gaming, like Dance Dance Revolution, the Nintendo Wii, the Xbox Kinect, now virtual reality interventions that combine exercise. I was just doing that this morning. And so there's a whole variety of categories that are attributed, or I would kind of bucket them in the neuromotor category.
Mhm.
And the ones you pick are once again dependent on preference. So if I was here preaching that virtual reality exercise is the best, there's going to be a whole slew of people that it's cost or technology prohibitive or
Right.
preferentially prohibitive. What if you don't want to do that? But if I also say dance is the best form of exercise, I'm sure I'll get tons of people that are big fans of that news, right? But then I'll get a bunch of other people saying, I don't want to dance. And so with that said, the neuromotor category isn't barking orders. It's a menu in a restaurant. So it's usually the one that people are missing from their exercise program, because when they think about exercise, they think about aerobic and they think about resistance. And most people aren't doing enough of either.
Right, right.
But that constitutes the physical training. The motor training is stuff that's more neuromuscular and more directly cognitively demanding. And it doesn't mean that aerobic and resistance exercises cannot have cognitive demand. They do. But we're turning the volume knob a little bit up on that motor category. And it allows us to directly challenge our cognition, which is really cool. With physical training, usually what's happening is the blood flow and the growth factors and the hormones, it's a bottom-up approach. The brain is a passive receiver of all of those benefits, right? On the other hand, with motor, the brain is an active participant in those interventions. And so that's why it's important to include it, in my opinion. And there's for this evolutionarily, there's research continues to show in older adults, even those with cognitive impairments, that this type of exercise can either produce equivalent benefits to other forms or superior benefits, and additional mood benefits as well, because what sounds more exciting, playing tennis or dancing or riding on a bike and spacing out, right? So some people just have that preference. In addition, there's some longitudinal studies in Europe showing that people who played racket sports live longer than people who went to the gym. Wow. Now, don't go to the gym? No. It means that there's this potential unique value. Also, it could be just socioeconomics and entitlement. I don't know who has sport, but I think that's important to state too. Sure. But also mean that has benefit as well as the other stuff we consider to be exercise. Mm-hmm. So when we talk about neuromotor or dual task exercise, that's what I mean.
Right. Okay. And and I wanted to also talk a little bit about, you kind of touched on the different areas when you are, dual tasking, or when you're in a brain health training session. And I think a lot of people, when they think about cognition, they really just think about memory. That I'm
Yeah.
forgetting things, I'm losing memory. And I've actually had a lot of clients that said, okay, so are you just gonna um, I'm basically going to do recall. So I'm going to give you some words, and then I'm going to, have you recall them. And, really we're talking about a lot of different domains when we're talking about cognition. So,
Mhm.
looking at the executive functioning, all those higher level processing skills that we have to have, and the attention, the reaction time,
Yeah,
balance, all those things playing into our
absolutely.
cognition. And
And
it's something.
cognition has many different domains. And so cognition are a set of mental functions that allow us to interact with the world external to us and internal to us. So what's required to do that? A lot, right? So
Right.
we have to react to stimulus. We have to process information visually, auditorily. We have to memorize short-term, long-term, episodic semantics. We have to be able to, use our executive functions, organizing, planning, short-term memory or working memory, cognitive flexibility, or responding to unexpected circumstances, impulse control. And so you're right, we have these different domains. So what can we do about it, right?
Mhm.
We took a general approach, the one I've kind of been promoting. You're going to have a global effect likely on these cognitive functions, right?
Right.
And global is good. It's challenging to target each one for a variety of reasons. Research is a bit nuanced and difficult, and we need more of it. And cognition is more integrated. It's kind of like if I targeted the middle of my calf, the medial gastrocnemius, I just did that. Would that significantly improve my walking? Maybe. But we know, even the mainstream folks know, that integrated full body training will probably be more functional. And
Right.
so when we talk about function or activities of daily living or just interacting with the world or cognitive function, what we think about is integration. So in reality, these things are integrated. However, there is this, it's called a process training approach where you target one function, or maybe the way I talk about it is
Mhm.
we put the emphasis a little bit more. So certainly tennis or ping pong will have more attention and processing speed demands versus dance, which will, if it has choreography, will have more memory demands. I think that makes sense to people. So if I had more of an attention or processing speed goal, I might do those a little bit more if I had more of a memory goal. And that would just be working on it directly.
Right.
On the other hand, why does aerobic exercise improve memory when there's no memory performance needed to ride on a bike? It's an automatic movement.
Mhm.
Listen, right? And so why would we improve our memory in that case? Well, because there's an indirect effect. The neurobiological stimuli, the BDNF, the blood flow, the increase in hippocampal volumes in the area of the brain responsible for memory. So if we want to take an indirect effect, that's why it's important to have resistance and aerobic. And also we're seeing that different acute variables might facilitate different outcomes. So for example, high intensity interval training might facilitate greater outcomes in processing speed. And it kind of makes sense
Yeah.
because you're moving faster, right? So specific adaptation on imposed demand. So some of the research does make sense, and then some of it's really confusing and doesn't serve this bias. But if we did follow that process training approach a little bit more, if someone said, I have an attention issue, I want to work on that, okay, and you come into the gym or you're doing a virtual class with Carissa, what does a brain health trainer potentially do? Well, first, a good brain health trainer helps you set up this multimodal exercise program outside of your sessions to make sure you got that. It's an exercise counseling process. That's what a good brain health trainer does, first and foremost. The second thing a brain health trainer can do is incorporate these cognitive dual task techniques, cognitive motor dual task techniques in the session. So if I'm doing lunges and I want to work on my attention, I can throw a ball at someone. And that sounds silly, but what is that? Visual attention, reaction time. I
Mhm.
can make that harder. I can make it faster. I can make it more where it's task switching and you're switching between two balls or switching between two tasks. And I can also make it more of a memory demand. I can give your lunge 4 to 6 directions. I'm going to have you memorize those directions in space, and I'm going to call them out, or I'm going to call out a sequence of directions and have you step on them in the order I said them or the reverse order I said them. And so we can use all of these modifications, these cognitive techniques in functional movements that we hope translate to your real life. We need more research on that.
Right.
That represent the research that says this could be helpful, right? It's just that nobody is doing them. And so that's why I teach that in my course, because aerobic training, resistance training, that's higher knowledge for health professionals. But neuromotor training, specifically dual tasking, is not. And
Right.
so it's just to give people a primer, some ideas about how to incorporate this. And also, if we're going to do that, let's try to be specific, because otherwise we're just doing something for the sake of doing it rather than having a reason. And so that's why we take that process approach.
Right. And I think too that it's, when you've talked about that goal in mind, if you don't have your why, you're not going to do it. So if you, kind of really establish what the goal is, what the why is, it's much easier for people to follow through and to take action on it.
Yeah.
And I think too, a lot of times it's just something that, there's a lot of different types of people that can benefit from this, not only just, like we're talking about preventatively, but even people that are starting to feel some changes, or, people who've already been diagnosed with a neurological condition. And, that the research is showing that there is still benefit, that you can still, that neuroplasticity of the brain, we can still change things. So
yeah, it's really, we think it's never too late, right? And I was more confident when I first started that everyone can benefit. I do believe everyone can. Where the research needs more evidence is what happens in people with dementia, right? With Alzheimer's disease, depending on the stage. Prior to that, there could be mild cognitive impairment, which is a diagnosable condition, and it's underdiagnosed. So if you have cognitive issues, you need to speak with your doctor to get, even if you think it's normal aging,
right.
You want to find out, right?
Yeah,
So
right.
there are things that are normal aging, and there are things that are not. And it's not to create anxiety or awareness or even hyper arousal around that concept. It is important to have an evaluation, even if it's brief, even if it's qualitative with your doctor, so that they can determine if they need to refer you to a specialist like a neurologist, a neuropsychologist, a geriatric psychiatrist, whatever it may be. And so once you get that, you can, even if there's nothing wrong, you have a baseline. So that if something happen, a stroke, a fall, a surgery, a concussion, a disease, you can compare, right? And track it over time. And ideally do something earlier rather than later.
Right.
And that's really important. So it is for people who have an issue or not. It could be, I'm worried about it. It could be, I've noticed changes. We call that subjective cognitive changes. It could be, it's a little bit more severe, but I thought it was normal, but I listened to this and I'm thinking that it's not, and I really need to get that checked out. That could be for someone else as well,
right.
And then it often is. And then it could be dementia, diagnosed or undiagnosed, or maybe it was diagnosed, but maybe it was not given a specific type. So there's Alzheimer's disease, there's Parkinson's, there's Parkinsonianism dementia, there's Lewy body dementia, which can also occur a lot in Parkinson's disease. It's a little bit more rare. Frontotemporal dementia, vascular dementia, mixed dementia. So they're not all created equally. They all have different pathologies. And that's why it's really important to go see a doctor, especially a neurologist, to diagnose and differentiate, if at all. And so research is showing that with these cognitive motor techniques, and even with exercise, that they can improve in cognition. But there's been some longitudinal studies that came out that contradict that, where it says, oh, well, people with dementia exercising got worse. Well, we don't know enough about that. Well, what if it was lower intensity? What if it was a different type? Maybe they didn't enjoy it. Maybe it was the age group. Maybe it was all these different things, right? So I am going to be putting my bets on that. It can help everybody. However, it's going to look different for everybody.
Right.
But on the other hand, just moving probably is beneficial to everybody.
Right, exactly.
There's some strange contradictions where we want to make confident recommendations. We want to make specific recommendations, but sometimes really only the general recommendations, as general and not as sexy as they are enough and sometimes better. So it just depends. But that's why it's important to work with someone such as yourself who understands this stuff and can work with people that also understand this stuff, like medical professionals, to
Yeah.
figure that out. And just like you'd work with a doctor as a nutritionist, you'd work with a doctor as a brain health trainer to help figure out what's best for people based on the available information.
Yeah. And I do want to emphasize what you said about, you know, getting those evaluations if you have any fear or worry, or even just for prevention, because I think there's so many people that they don't want to know. They don't go because they don't want to know.
Yeah.
And it used to be, well, I don't want to know because there's nothing I can do about it, and then I'm just going to worry about it. But there
Yeah.
is, like we're talking about here, there is a lot you can do about it. And
That that's
to
right.
not be afraid to get those tests and to see where your baseline is so
Right.
important.
Right. And so I would say for those people, would you be afraid to get your blood pressure checked?
Right.
Right. It's a little less stigmatized.
Yeah.
But you know, the brain is an organ. And so we need to check out all of our organs frequently, right? Or at least once a year. And so I think physicals are now starting to incorporate brief cognitive tests, which is right. And we're talking PCPs like GPs and stuff like that. So that's getting better. Physical therapists are starting to incorporate more cognitive testing. Hopefully, personal trainers and movement professionals and even nutrition professionals can be a beacon of referral and scientifically correct education. I think that's really important. So you don't need to get every type of evaluation, but you do need to do something, even if it's a conversation or a brief eval. That brief eval can be 5 to 10 minutes. And even if that's all you do, that's better than nothing, right?
Right.
Some people think they have to do the whole shebang, 3 hours of cognitive testing, volumetric MRIs to see the size of their brain, all this stuff. You may not need to. It's really based on your interest. But I would say, and all that can be insurance covered if it's medically necessary, and especially if you're in the geriatric population. So why not? Why not do that and get a better understanding of where you are? If there's something to be afraid of, we'll pick it out and we'll be specific. So we can address that fear, we can address that concern directly rather than generally. And then you have this chronic stress and anxiety, which is affecting your brain negatively anyway, right?
Right.
So
Right.
that's not going to be helpful, right? So that's not us. We do a lot of things that don't serve us, but that's one of them. And so and also even those with negative age beliefs, we have the anxious, but on the other end of the spectrum, we have the stubborn, right?
Right.
I am fine. It's normal. My dad had it, whatever. It's kind of like you can't do anything about it. But those with negative age beliefs, including those that think that is normal, are 50% more likely to get dementia, according to a few studies in some senior living communities based on a questionnaire.
Right.
That's really interesting.
It is. Yeah.
In your belief systems, you're going to choose your behaviors that maybe contribute or not to your brain health over time. So that would be an interesting question to ask people. And maybe, if you're talking to someone else, it's especially challenging if it's a family member, because you can't tell family anything.
No.
It's not always true, but I often find it's more challenging, or I hear it's more challenging than not. So,
Yeah. No.
or rather, I don't hear much complaint from the ones that it's not challenging with. But I would say that if you're on either end of the spectrum, see if you can flex your mindset a little bit, because if you're anxious and avoidant, or if you're stubborn and avoidant, it's your brain, it's your health. Find out and see where you're at, even if a little bit. That's going to serve you. It's going to allow you to be around longer, we would hope. It's hopefully going to allow you to understand where you're at so that you can better be around those that you love and be there for them and be cognitively intact for them and enjoy the world. You're here, but you do it with this, right? You need this. So check it out, see what you think, see what's going on. I think that's really important. And then when we come back from that clinical environment, that's when we get to work, right? And we modify our lifestyle. It doesn't have to be work, it's lifestyle. And that's why we're pushing the enjoyment piece.
Yeah, definitely. Yeah. Yeah. It's definitely, I think sometimes can be a big barrier for people. And also that motivation piece, I feel like if you know, okay, there's a little something going on, or there's something I can do about it, that motivation to exercise, to do some of these things, then even
Yeah.
is boosted even more, because I think
Yeah.
it's a huge problem for a lot of people is getting motivated, holding yourself accountable. doing
Mhm.
things that you want to do that are sustainable for your life.
Yeah.
And a lot of times as professionals, sometimes we can miss that piece is like, okay, well, these are the things you need to do, but it's that action piece. And, that's part of, why I named this group action plan, um, aging well
Yeah.
action plan, because a lot of times, like you said, we consume information, we hear all these things, we should be doing this. And sometimes it can also be overwhelming of there's all these things, but tell me
Yeah.
exactly what I need to do. And that's why having a good fitness professional to really look at what do you need, and developing a program for you and what your goals are.
Super important.
So
Super important. And I would say um, for those that feel overwhelmed, work with someone such as yourself, Chris, to help break it down, right? An
thanks.
accountability partner to help break it down, because
Yeah.
we certainly, that's not our intention, right? Is to overwhelm. Our intention is to add value. But human behavior is complex, and you shouldn't feel stupid or incapable or lazy or have a lack of willpower because you have trouble doing something.
Right.
That is your biology or your neurobiology at that moment in time. And so we shouldn't be worried about that forever, as we can outsource some of those cognitive demands about thinking about how to implement all of this from a behavior change standpoint with someone such as yourself. So I think it's important to do that.
Right. Yeah, and I just want to add in too that it really is a fun way to exercise. It really is.
It really is. Yeah.
For a lot of people, and I think, when you're the dread of getting on that bike or just walking on the treadmill, if you can change it up, and like we said, those are all good things, but if you can change it up and really challenge yourself a little bit, I've found with all of my clients, they just once they start doing it, it can be challenging and they get a little frustrated, and then we got to.
The cognitive motor training specifically.
Yes, exactly. And
Yeah.
then you gotta, kind of reel it back and change it up a little. But I think for most people, they say, okay, like this is actually kind of fun.
It
A fun
is. And
way
so
to,
anything in that neuromotor category, if you find something you enjoy, it is fun. That if you enjoy tennis, you love tennis.
right.
You love golf. If you enjoy kickboxing, you love kickboxing. And so when we borrow, it's some of the enjoyment might be that cognitive engagement. There's a social element there. You're there. We can't forget that. But even I interact with a robot, a virtual reality, and I still have a blast, right?
Yeah, right.
Something about that neuromotor category that's just so enjoyable. And there's a neurobiological rationale, there's a cognitive rationale, there's a psychological rationale for that, there's a social rationale, but it could be a combination of all of it, right? And
Right.
so it's this really nutritious meal that comes across as fun. And we hope it's beneficial over time. And it could be just task specific practice that you're getting better at the drills that you're giving them, which is why it's important to progress. And we'd also hope that in addition to enjoyment, you do feel a difference in your daily life. I think that's the important thing.
Yeah, absolutely. And then the one thing I just wanted to touch on, since we do have a lot of physical therapists in the group, because I think it's so important to, add some of these things to our patient care. Whether you're working with, an athlete, or you're working with an older adult that has balance issues, or you're doing fall prevention, I do think, looking at some of these areas is really beneficial to the physical therapy practice as well. So I just wanted you to kind of touch on where can they find your course, and more information on that if people are
Yeah.
interested.
So, yeah, they can go to brainhealthtrainer.com.
Okay. Okay. Perfect. All
Yeah.
right. Anything else you want to
Appreciate
add?
it. No, I'm good.
Okay. Well, this was awesome. Thank you so much for coming on today. And anyone that has any questions, if you want to put them in the chat, and I can always get a hold of Ryan and we can get
Yep.
questions answered. So,
I'm available.
okay, cool. All right. Have a great day, Ryan.
You too. Bye bye.
Bye.